Jamie with thedailyinfusion.com, where you can learn how to reclaim health, create wellness, and transform your life. I'm here with Tami Bronstein today, who is a expert on the neuroendocrine system, a phytotherapist, which is an herbal medicine specialist, and founder of the Medical Herbalist Apothecary. And we have done a couple of interviews before. You can check back from a few months ago. And we're going to move on to some different topics today. Welcome back, Tami. Happy to
Thank
have you
you.
back.
Thank you, Jamie. Thank you. It's so great to be back. I love our
Yay,
chats.
me too. So today, this is an issue really close to my heart that I want to talk about, which is dental health and how this affects our overall health. And so something that I've personally gone through recently is something called cavitation surgery. And I've had 4 of these surgeries in the past 3 months. And I actually would love it if you would answer, Tami, could you explain why I might have a surgery like this and what it is?
Well, cavitation surgeries, you're working in the gum under the gum. You're working at the root of the tooth, and it goes into the sinuses. You the teeth are the joint between the bone and your gums and the bone line. It's a joint, just like any other joint. It's an immobile joint for the most part. I mean, the teeth are not meant to move like a knee joint would be,
Right.
but it is a bone joint. And unfortunately, you can have infections. Uh,
How do they get there?
oh gosh, there's many reasons that you could have bone infection. Um, Sometimes people grind, they clench their teeth, and they put a lot of pressure between the tooth and the bone structure that it connects into. You
Hmm.
know, it connects into the jaw, it connects into the skull. So so the joint where the tooth is inserted into the bone, there's a tremendous amount of pressure when someone grinds or grips their teeth, they clench their teeth, and so you can create pressure, air, fluid can get trapped in that joint, and eventually there can be bacterium and infection. And
Right.
because it's so close to the sinuses, as I know you and I have talked about your surgeries, you can have sinus involvement.
Right. And for me, predominantly what caused this for me is improper wisdom tooth removal. So what happened is that years ago when I had my wisdom teeth removed, this is 17 years back, they didn't fully remove all the tooth and they kind of left a little bit of pocket there where infection just rushed right in to brew silently, and I didn't even really have symptoms except for maybe I thought was like what they call TMJ. It just felt a little sore, a little funny, a little off, but really nothing noticeable. I did develop allergies suddenly afterwards. I did start getting chronic sinus infections, but I never made the connection that, oh, it's because of that wisdom tooth surgery that I had. Like, it's not something I consciously realized until very later on, where I found out that these infections can seriously burden the immune system, especially when you start getting other things like Lyme disease for me really weighing the body down and other infections weighing the body down. It became pretty obvious that something was off.
Well, the thing is that when you have an infection or you have a pocket of infection, as it grows, as the bacterium multiply, and as they produce byproducts of infection like pus, mucus, and things like
All that
that.
fun
It's I
stuff.
know it's hope everybody ate their lunch and or they ate their
Dinner.
dinner before they're watching. But yeah, unfortunately, the infection has to go somewhere. The body does try to eliminate it, so unfortunately, what's the closest area or the closest region, which is the sinus cavity, is immediately um, surrounding these, even specifically the
Yes.
upper jaw.
You can have them. I had them in all 4, but
Right.
these were the worst areas because of the sinus involvement. Yeah.
Right. And the sinuses are a closed, contained cavity. And let's face it, what is the perfect medium for bacterium to grow? It has to be moist, it has to be dark, and it has to be warm. And the sinuses are a perfect closed cavity, a breeding ground So it was a perfect place for your infections to brew. And when it became overwhelming, you would go on antibiotics because you'd have symptoms of a sinus infection, not knowing that it was really the dental work that was
No
uh,
clue.
invading your sinuses.
Right.
It's
And
pretty
it's
tough.
kind of shocking actually when I had the surgeries immediately the effect of how much energy actually came back to my body, and I actually got to feel how much it was holding on to. It was like the immune system could be like, "Ah, we don't have to work on that anymore, thank God." And I could breathe, and I mean it's pretty dramatic, the
It
improvement.
it is, and we know anybody who has a relative or themselves have the prosthetics in the heart or any kind of bone or joint prosthetic, like a prosthetic hip or a knee, they have to take antibiotics before having dental surgery. And
Mm.
why is that? Because through the oral tissues, you can introduce these bacterium to the rest of the system, the rest of the body.
Mm.
So it's not just contained in your head and neck. You have you have systemic exposure. So people who have prosthetic heart valves or any other um, replacement body part, they have to take antibiotics during even routine dental cleanings
Mm.
because you are exposing the bloodstream. You have a lot of capillaries, a lot of blood supply in the gum line, and it has a lot of uh, beneficial function to have blood supply, nourishment of the tissues. But the flip side of that is systemic exposure.
Right.
So you had the Lyme disease, which so yes, you're sustaining the infections in the sinuses and in the bone. I think you said you actually had necrosis or the
Yeah.
bone tissue death, which
Right.
the tissue was just dying.
Yeah, they actually went in and they had to cut out the infected jaw, and they removed the infection in the sinuses, and I could actually see it, and they take it and they biopsy it, and it came back with necrosis, which is bone death, which is
Right.
living essentially with dead bone in this area for 17 years, and that's quite a burden on the body to try and take care of that on top of all these other viruses and infections that I was exposed to all these years.
Well, part of the process of the body fighting it is obviously the body tries to contain it and tries to um, sequester the bacterium. So, what does that mean? That means that the body tries to wall it off or contain it. Sometimes it will develop a fibrous tissue or a capsule to contain it so that it doesn't spread wildly through the body. So that constant process of containing an infection is a tremendous burden on the immune system. So you're susceptible to anything else.
Mm-hmm.
And the same thing with the Lyme disease. The body tries to contain it because you had the third stage, which goes into the central nervous system. So the body tries to contain it and prevent it from spreading. But yeah, I when you told me about 4 surgeries and as we followed each procedure and how you felt after each procedure was a fascinating process. You want to talk a little bit about the difference between the first surgery and
Sure.
your recovery from the first one and your recovery from, say, the last one?
Yeah, well, I mean, I think the first one going into it, obviously, the first time we have any kind of surgery like that, there's a lot of fear and a lot of emotional stuff that you go through that can make it a little bit rougher. I didn't know what to expect. I didn't know, what the surgery exactly entailed. I think I purposely didn't look up too much information, but but yeah, basically.
That might have been okay.
Right. Unfortunately, with the first surgery, I my body was still very burdened. It was at a place where I still had a lot of issues going on, and even though I had the surgery and I immediately went to see my osteopath that day to get a vitamin infusion just to boost the immune system, and we did some other homeopathic treatments, but still the immune system couldn't quite the lymphatic system couldn't drain all of what had been released from this first surgery, and my lymph nodes started to swell, and it was very uncomfortable. So I was having a hard time detoxing everything that got released after that one tooth, and that's when the doctor said that we're going to have probably one site at a time, because your body is so burdened, has been through so much, that we need to take it easy and gentle. A lot of people, when they have their wisdom teeth removed, they do all four of them at once, and actually
Yep.
my dentist, he's very wise. He says he would only do even one side of the mouth. You never cross sides of the mouth. That there's a reason. You don't like to cross contaminate. You don't burden the body too much. You have to do it based on what the individual dictates. And my body was needed gentle and easy.
Which is wonderful in this at this point in time. But when I had my wisdom teeth out over 25 years ago, they did all four.
Well, me too. That's why I ended
That's
up
it.
I had a horrible recovery. Like, looking back on it, it was like, no, I had dry sockets. There was weird things that went on where clearly what we looked on the x-ray, and then when he actually went in and saw, he cut off like my sinuses. He left fragments of tooth that had worked their way up into the sinuses. It was a mess. And I had no idea. I'd been living with this that whole time. But starting with the first surgery, it was just like my body was like, what just happened? But what was interesting, even though I was having a hard time processing, within about 3 days, I got this amazing surge in energy. It was like, oh, that's what this is about. Like, my body is like relieved. It's relieved. It doesn't have to deal with that particular infection anymore. And something interesting that we did is we actually took samples of the infection that was in there to make homeopathics from them. So now,
Fantastic.
can you explain why we did that?
Well, what you're the theory of homeopathy is
Mm-hmm.
like cures like. So what
Mm-hmm.
they're doing is creating almost a vaccine, if you will.
Mm-hmm.
So they're using the bacteria, and they're diluting it. They're creating a product. It's not herbal medicine, but homeopathy is separate
Mm-hmm.
in the sense that while they can use plant based products like poison ivy or poison oak or poison sumac, they'll actually create a highly diluted preparation so that you're introducing the irritant and you're forcing the body to mount an immune response to it.
Mm-hmm.
So, but the thing about homeopathy is they don't just use plants. They could use metals. They can use bacteria. It's a vaccine base. So
Mm-hmm.
you're talking about using that bacterium and creating a substance that the body will mount an immune response towards, so that it can form antibodies that will fight the infection.
Right.
So that's what they did. So it
Mm-hmm.
was that's not herbal medicine, and that isn't even homeopathy, but it is immunotherapy. It
Right.
is working with the bacterium and creating your own vaccine, which is what they're doing in cancer research as
Hmm.
well. They're developing, just like they did also with Ebola. They use the bacterium to create vaccines or
Mm-hmm.
create some kind of homeopathic like response.
Right.
Now there is obviously the the aspect of vaccines which I don't agree with, which is not the theory of like curing like. It's the chemical
Additives.
excipients.
Yeah.
Yeah, it's the additives, it's the carriers. I still, for the life of me, don't understand why they cannot come up with something that doesn't contain formaldehyde, urea, aluminum, ammonium, all kinds of toxic chemicals. When the theory of vaccine, the theory of homeopathy, is does have viability.
Mm-hmm.
Obviously, we've reined in certain infections with vaccines, but it's with the mercury components. I understand they're looking for shelf life and stability, but there's got to be another way.
Mm-hmm. Yeah.
But that's basically what they did. They obviously didn't put that in a chemical base
No.
because they were making it just for you.
Right. Specific to what was actually in my body.
Exactly, which is fascinating. I mean, it's
Mm-hmm.
absolutely fascinating
Mm-hmm.
to hear of these advances. Not every dentist or oral surgeon does what your practitioner has done.
Well, I mean, I asked for that portion just because it's something that I researched. I found out from other Lyme patients that it was very common to have something called cavitations that could be holding your healing back and creating this relapse that we go into and you stay chronically ill. And one of the main reasons that I kept hearing over and over again was cavitation surgery, cavitation surgery. And it just, when I looked more into it, it started making sense. Oh yeah, like when I look back at the timeline and the issues that I have in my sinuses and overall just feeling certain sensations that weren't quite normal right here, it makes sense. And then to then see it confirmed when he actually went in there and then biopsied and he could see it was just raging infection. And yeah, pretty amazing. Pretty amazing.
But the fact that now, okay, so you went from the first surgery,
Right.
which really knocked you
Yeah.
flat for a while.
Yeah.
Um, and then I know you went, each one, it seemed that you were gaining on it, but they then had to, with your response to the procedure, they had to push off the next
That's right.
surgeries. And I think you were going to do two surgeries at the very end, and then they changed their mind.
Yeah, actually, what ended up happening after the first surgery, we were going to schedule them 2 weeks apart. And I went in to have my second surgery, and I actually couldn't open my jaw because the muscles had stiffened so much. I had such a my body kind of had this tightening response. It was kind of traumatized a little bit from it. It didn't
Yeah.
really know what to expect. That my jaw was too clenched, and so they had to push off that surgery and initiate some
Okay.
other therapies and doing more osteopathy, which is really manually manipulating the joints up here to release
Yes.
the tension that I had in my jaw.
And
So,
that's a good point, because you have joints, like we talked about, the joint between the tooth and the bone,
mm-hmm,
the maxillary bone and the mandibular bone. So
mm-hmm,
the maxilla is the upper,
sinus, yeah.
the upper portion of your cranium, and then the mandible. So you had the lower jaw issue as well.
Mm-hmm.
But you have joints in the actual cranium as well. You have what we call sutures. And again, they're not mobile joints, but they are bony joints. Obviously, if somebody's been in an auto accident and they have brain swelling, the bones will expand. But that's not what happens in everyday life. But you have joints and they do shift. And some of these osteopathic techniques can help to realign uh, bones that have been shifted. And in your case, probably from the pressure of infection.
Mm. Yeah.
And also from muscular tension. So from pain and from clenching, your muscles in the jaw attach into the cranium
Mm-hmm.
and affects the attachments onto the bones of the skull,
Right. So we
and
had
that
to
shifts
release.
the bones as well.
Yeah, I mean, I was a little disappointed, but it ended up working out it just as it needed to. And yes, we went in and we were hoping that I would be able to do two at once. But once again, my body, when they went in to go do the second one, he saw how bad the sinus involvement was, and he did not want to put more pressure. And he said, I'm making the official's call to not do more than one in this surgery. Even though I wanted
Right.
to, I was like, let's get it done. I want it done
Get it
before the new
done.
year. I'm like, I want to start 2015 without these infections I've been carrying. Come on. But no, he said that it was so badly involved in the sinuses and the nerves up there where he had to go around the nerve. He wanted it to heal as smoothly as possible, which I am grateful for ultimately.
Right.
And that second surgery, I did end up recovering quite well from. It was a much speedier recovery. And then we waited 3 weeks to do the third. And that one was actually probably the roughest, I should say, because it was this part of the sinuses where it had the most infection. And
Okay.
apparently, what had happened is when they went to do my original wisdom teeth removal, he had cut off my sinuses. So, where your sinuses would drain here,
Oh.
they completely cut it, and there was nothing lining the sinuses between the tooth and the sinus. It was just completely exposed. So it was intense. It was painful. I'm not gonna lie, but it was absolutely necessary, and I was grateful to know like we're getting rid of him, releasing this, and he rebuilt a lot of the lining for me. And yeah, now it's that part is doing well and it's healing very well. But initially that was rough, and I did not want to have another surgery anytime soon after that. I was like willing to rest.
Okay, wait, that was the third?
That was the third. That was the
Okay, so have
third.
you had the final?
I have had the final
Okay.
about 2 weeks ago. So I had the final one, which was this part, the lower jaw here, which he said was the easiest one, the least amount of infection, and the least amount of issue. So that one was just kind of like, oh, okay, I got it by now. And
Right.
so at this point, so it's been like a week and a half, 2 weeks, and you see I'm talking and it's fine and I'm moving around and I feel great. I really do.
So tell me about your the drainage and your breathing and your chronic sinusitis, because
Mm.
I'm sure you have a lot of people. I see a lot of people with sinus issues that I support, and so my question is, how is it for you with breathing? Have you noticed less pressure? Have you noticed any change in the nasality or the nasal tone of your voice? Do you notice anything draining in the postnasal region, the back of your nose and throat? Tell me a little bit about your experiences over the whole process and how you're feeling.
Well, there was definitely draining going on, but the thing is, I couldn't blow my nose, sneeze, or take a deep breath for a month for each of them. So that was a little tricky. So I felt a lot draining in the back, and yeah, there was a period where it was a little stuffy because of that. But then now that I'm over the hump, it's definitely I breathe better. I'm getting more air into my lungs. I can feel like taking a deep breath is, oh, this is what it feels like. You're actually supposed to get oxygen to your brain. And like I was getting half the amount of air in before. It was
Mm-hmm.
really dramatic, the shift. So I'm just noticing that, and the energy. It's just the amount of energy that I received at this point. Now it's as if like I feel like half of the Lyme disease is gone. It's like my body could address a lot more of those issues. And I feel, I mean, I don't like to use the word normal, but for me, compared to where I was, if I could go running, I would. I'm not supposed to do any heavy exercising, but that's the kind of energy. I feel clear. Clarity is back. It's not like that heady brain fog.
Is there a reason why they don't want you to be more active at this point?
Well, just for healing, just because there are
Mm-hmm.
stages of healing that this, I'm still kind of in the first stage of healing. I just
Right.
started these surgeries. It was at the end of October. Then I had one in November, then December,
Mm-hmm.
then January. We're still in January of 2015. So this is still kind of recent, and I'm not messing
Right.
about. Like, I know when a doctor says take it easy, and I know how my body tends to react if I overdo something. I'm I pay for it later. So,
So, what does he
yeah.
say about the bone loss, the area of the jaw where he had to remove a lot of bone?
Hmm.
Has he done any kind of scans to monitor the regrowth, or is it just a matter of waiting 6 months to a year before they see how far your healing has come?
They say it takes about a year for the replacement to harden. They used some form of calcium
Okay,
to inject. They injected it in, and you can't even tell. Like it looks like a normal jaw or whatever, but it's still healing, and it's going to
right,
take about a year to completely harden. He says. And there is a little bit of funky stuff with the nerves that can happen. So just right over here, I always had a little bit of tooth sensitivity. And what happened was the infection was like kind of wrapped around the nerve. So as a result of removing that, the nerves are kind of confused. So there is a
right,
little numbness that will go away over
right.
time, and it slowly come back. It was completely numb after the surgery, and now it just feels like sometimes I'll get tingling sensations, or the nerves are
Right.
waking up again. So you are disturbing some stuff when you go in.
Absolutely. And anybody who has had wisdom teeth removal, they know they have to sign a waiver
Mm.
because there is a nerve that can be damaged and you can have permanent nerve damage. So, uh, unless some patients don't they sign, they don't really know what they're signing for, but
Hmm.
that's basically what it is, because
Right.
there is that risk in wisdom tooth extraction to damage the nerve in the jawline.
Hmm.
So it's pretty immense what you've been through.
Yeah.
uh, bone resection,
Yeah.
going in and clearing out the sinuses, rebuilding your sinuses. It's it's a fascinating process. I mean, I know that we're talking about some things that maybe people are a little squeamish to listen
Yeah.
to. You can't be faint of stomach.
Definitely not. It's like, yeah, I definitely had my jaw cut out. Not
Yeah.
something that we do and think about in everyday life, these hidden infections, but it's important that people understand the connection between what's going on in their mouths and overall in their bodies and how that has an impact. That it's not just from this, you can get it from a root canal where people go in and have root canals and then infections can form where they've had root canal work done and it's completely silent. They have no idea there's an infection brewing because often it's symptomless, completely
Right.
symptomless, which is why it's so hard for people to wrap their head around, like, why would you go in and do that? But no regrets here. No regrets here.
Yeah, I mean, and some of these substances, such as anti-tumor necrosis factor, some of these inflammatory substances that increase systemic inflammation. Um, it can cause digestive
Yes.
problems. It can cause inflammatory bowel disorders, to have chronic infections of the mouth, of the dental tissues.
Yeah.
So it really is quite profound. People don't realize that that what they sustain in their dental work or dental caries um, can affect them system wide. And so when you're talking about the entire digestive system, I mean, if you again, one of these things that I describe to people, that you hope they've eaten their meals, but your digestive system is one long tube from mouth to anus,
Mm-hmm.
and you have segments through the digestive system. So if you have the mouth and then you have the anus, there's a lot that goes on along that pipeline.
Yeah.
So if you have something going on in the mouth, it can affect anything along the digestive tract. So people that have chronic inflammatory issues really need to take a good look at first at what's going on with their teeth and their gums and their tongue and their salivary glands and the sinuses, which obviously drain
Yeah.
into the digestive system.
Yeah.
And
When.
then it sounds pretty gross, but it does. It drains and it can create acid reflux. I know I have patients who are dealing with a chronic reflux because of chronic sinus issues. So
Mm-hmm.
it the body's a miraculous.
Amazing. Really.
It is a miraculous creation, and but everything is interconnected, and you can't just isolate one body part and not see the rest of the picture.
Yeah, this is why he's called a systemic dentist. It's systemic dentistry. He looks at the body holistically. And I remember when he was going in, I was awake throughout these whole things. That's another thing that he suggested to keep my body grounded, that I stay awake and I be
Right.
present in my body. So I was aware. I saw everything that was happening. And so he was talking to me and letting me know when he went in, especially into the sinuses. And he was like, whoa, you've got raging infection here. Like, look, there's like cysts coming out. Like, sorry, people, but it's stuff that was there that we all can have. And he said, this is why you have gut problems. He's like, this right here is connected to your gut. This is why you can't get over your food allergies, why you have the leaky gut that can happen, aside from the antibiotics that I took and over time the things that happen with chronic illness. But it's completely connected and people don't even think about it.
Exactly. And there are studies. There are clinical studies, but most people don't read clinical studies. I mean, I happen to just be a big nerd, and I happen to like scientific journals and
Yeah.
reading scientific
Well, we're glad that you
processes.
do, so you can share the information to us in a way we can understand.
I mean, for me, it's like Sherlock Holmes and
Mhm.
getting to the mystery,
Yeah.
because really it's the fear of the unknown
Yeah.
that really catches people off guard. If you can shed light on the technical side, even if you don't remember the names, you don't remember the processes, you don't remember the physiology or the pathophysiology, doesn't matter. You have a mental picture, and that's my job, is to create a mental picture for you, so that you might not remember any of the clinical terminology, but you will know in your mind how things fit together.
Mm.
So that's the fascinating part about it. But I'm interested to follow along your healing and see how your digestive system, because let's face it, anything with the body's natural processes is not, it's not a quick fix.
Mm-mm.
You introduced my work in the neuroendocrine interplay. And basically, when you're dealing with the central nervous system and the endocrine system, it takes cycles,
Mm-hmm.
months before you see how things are evolving,
Mm-hmm.
because everything's quite subtle. The body adapts over time, which is why the doctor says, we'll check back in a year before, see how things are healing and hardening, because bone is an active metabolic tissue. People think of bones as just this hard, dead uh, structure, but really it's active endocrine functioning tissue. It's a bank or a storage. It's a repository for calcium
Mm-hmm.
and minerals. We the bone marrow, we create blood cells, and it's all a part of cell production. So it's very active tissue, and we talk about things in the diet and inflammation, and what is the process of inflammation is acid feeding the process of inflammation. And what does the body do to neutralize that? Because the kidneys regulate acid and alkalinity in the body. And what does the body do? It draws the calcium out of the bones to circulate and neutralize the acid, because calcium is alkaline.
Mm-hmm.
So, um, so even when you talk about soda, drinking soda and creating acid from the carbonation, but also the chemicals, the phosphates and the different chemicals in the soda, the body has to neutralize that. So it will draw calcium out of the bones to neutralize the acid from the chemicals in the soda, and so
Mm-hmm.
you have a rotting or a degradation of bone tissue.
Mm-hmm.
So it is an active process. So that's why your healing takes so long, because bone tissue is not inactive. People think it's just there for structure, but it's not. It's a very dynamic tissue, just like muscles and blood and any other organ. It's a very dynamic system.
Mm-hmm.
So it does take time,
Yep.
and it's fascinating. It's really truly fascinating. But over the next year, just because you had the surgery doesn't mean you don't pay attention to
I'm still
your,
supporting my body. No, I
yep,
have treatments
nutrition.
and I have vitamin therapies and infusions that I take to support my body so that I can continue healing. And I'm not ignoring everything else. I'm
Yep,
actually waiting a little bit to see my osteopath so we can re-examine the blood work to see where my hormones are, to see what's going on, and tailor the treatment then, because what I needed 4 months ago is not what I need now, and what I'm going to need 2 months from now is going to be different than today. And I know
absolutely.
that. So,
And that brings a very interesting point, because um, some people that come to see me think, well, I've seen you once, and this is the problem that I'm coming to you for, and how come it's not fixed in a month? Well,
Oh.
it doesn't work that way because
I wish
the
it did.
I know, I wish it did too. But what happens is, you give the body what it needs to balance itself. It gets to a new state of being, but you have to change and evolve what you're treating with to accommodate where you're healing and where things are still not quite right, because
Yeah.
it's not a quick fix magic bullet process. And so that's a fascinating point that you brought up. I try to tell people in the beginning, listen, this is not a quick hit. This is something that it's a journey. It's not a forever thing, but it is a journey uh, to work with the body's natural cycles to
Yeah.
get to where you need to be.
Yeah.
And life is dynamic. It's not static. It's always changing, always evolving, and not only within ourselves, but in response to our environment and to our relationships and to our lifestyles. And so it's constantly evolving.
I think that's a good point to end on, which is that everything in this universe is interconnected with everything else. And that goes for our hormones, that goes for our teeth, it goes for our moods and our emotions and how we react to each other. It's all about that, how things are connected with each other and understanding that the patience that's involved in allowing things to heal as they need to in relationship to one another. And everybody is different. Every physical body is going to react differently and heal differently. So there's no one size fits all. This is how it's going to look.
Now, I know that this coming out with your experience, your
Mm-hmm.
process, this was a big deal for you
Yes.
because you help other people with chronic illness
Mm-hmm.
because of your journey through Lyme disease. But this was something that was, while it was obviously interconnected with your ability to heal and recover from Lyme disease, but it was separate. It was
Mm-hmm.
something that occurred before your exposure to Lyme disease, and it was
No, actually.
festering all that time.
I actually had it before, like I had the Lyme disease before I had my wisdom teeth removed. So
Before.
actually, I had been living with it for probably most of my life.
So it was reversed.
Yeah, well, yeah, I had had those infections for my whole life, and then boom,
Okay.
after I had the wisdom tooth surgery was when I really noticed. That's when I developed allergies, chronic sinusitis. That's when things just started getting chronic, like really
Okay.
obviously chronic. There were some other issues that I had going on as a teenager, but it was not anything I would connect with Lyme disease or my health because I didn't even know what Lyme disease was back then anyway.
Okay.
I had
So
no
you were
knowledge.
already so you were already battling the Lyme disease, and
Without my
then
knowledge, though.
okay, but then the wisdom uh, issue, the wisdom teeth
Was 17 years ago.
extraction,
Yeah.
is what really set the rest of it in motion.
That and then it was like a few years later having hip surgery, having fractures and traumas to the body really were what awoke the line, and I guess everything else that came with it, and it was just slowly
Okay.
but surely things just took a nosedive eventually. And
It was it was like opening the floodgates,
yeah,
in other
every
words.
physical trauma, every emotional trauma, every major trauma that could happen to a person on all levels will flare up and come out in your body somehow. The body will react. So
Exactly.
it came to a point where I decided to take personal responsibility and do a lot more research to find out what was going on, and everything led me to all this new information about dental health that I was like, this was still just kind of 2 years ago I found out about this stuff, and I waited. I wanted to find the right person who felt right, and I found that person. I waited till I had a holistic team in place that could support my immune system after the surgery. So I don't want to say like you should just go have this surgery, but make sure you have the right people for follow-up support who can really, help keep your body nourished and balanced and healing on the right track so you can touch base with them. Hey, things aren't, my lymph nodes are swollen. What's going on? Okay, I go in and I see my doctor. He helps me drain my lymph system. You have to have people in place, a team, really, if you're considering doing something like this. Don't just go in blindly. Do your research. Go with what feels right and have the right team for support. I know that's something that you agree with.
Absolutely.
Yeah.
And it's all about integration,
Yes.
because there's no single method that is the be all end all cure all.
No.
There are many different facets or aspects to moving in the right direction. So
Mm-hmm.
it there's never just one. Uh,
It's one
um,
layer of the onion. This was one layer of
yeah,
many layers to be
absolutely.
uncovered.
But this
Yeah.
was a big deal for you to talk about it. I
Yes.
know that we discussed it through, through the process of making the decision and going for the surgeries and the process of the surgeries. And I mean, obviously you're very open about your battle through Lyme disease, but this was something that I guess it was a pivotal point in the
Yeah.
whole picture for you.
Right. Well, it got to be to a point where this is something that I know millions of people probably have without their knowledge, and it felt more
Yes.
important to come out with this as someone. I wanted to wait to experience it for myself so that I can report back and let people know what the experience was like and the benefits of it and some of the complications that can happen, that this isn't all smooth sailing. It's over time. I'm going to continue receiving the benefits from this. I mean, each surgery I kind of felt a little set back because there's trauma to the body. So it's
Right.
like it takes a week to kind of recover from that. And then, they went back in and then I kind of got knocked back again. So I had to plan for a few months of taking it a little more easy. And a lot of people didn't even know I had, recently had my jaw cut out, or like they didn't even know that was going on. But I wanted to wait to report back when this was all over, and I will continue reporting on how it's going. So I'm so glad that you were here with us to uncover some of more of why this is so important.
Well, thank you for inviting me. I know that I fumbled over my words a little bit
No, you're great.
because my brain spins 5 miles down the road before my mouth can catch up. But
Yeah.
I'm most pleased to shed light and perspective from the whole body viewpoint, as
Mm-hmm.
opposed to just a narrow, what we call myopic uh,
Mm-hmm.
uh, view, which is seeing something in a narrow view as opposed to how it fits into the bigger picture. So
Exactly.
it brings me such a sense of fulfillment and affirmation that I can be here as a resource for you in just answering questions, or hey, I kind of experienced this, what do you think is going on, or
Mm-hmm.
we did took these steps and I'm not feeling so great, what do you think happened,
Mm-hmm.
and just giving you that perspective to be thought of, even to come to for perspective,
Mm-hmm.
is immensely affirming for me, because I know this was such a traumatic process for you. Not just the actual procedure, but the concept of
Mm-hmm.
all of it.
Yeah.
So it brought me tremendous pleasure to be here for you as a friend, as a
Mm-hmm.
colleague, as a professional, as just me
I'm
coming in
so
and
grateful. You are a blessing, not just to me personally,
oh,
but to us all, a gift in sharing your knowledge and
oh,
wisdom. And so much gratitude to you. And thank
thank
you for
you.
being here. And as always, like, comment, share. We'd love to hear your thoughts. And don't forget to subscribe to stay updated on the latest videos. And we'll see you soon. Bye.
Bye.